All right, let's be honest for a moment. I know exactly how this usually goes. Things start out exciting. The moment feels right. You're with your partner, there's chemistry, connection, everything seems lined up. And then a few minutes in, you feel it slipping. Your firmness fades, your confidence drops, frustration creeps in, maybe even embarrassment. And suddenly, instead of enjoying the moment, your mind is racing. If this has ever happened to you, I want you to hear this right now. You are not alone. And this does not mean your best days are behind you. I'm Dr. Jocelyn, a urologist with 5 years of experience helping men protect their health, restore confidence, and reclaim satisfying intimacy. And I'm here to tell you something that surprises a lot of men. Not only is losing an erection during sex extremely common, it's also one of the most fixable problems I see in my practice. And today, I'm going to walk you through the 8 most common reasons erections fade during sex. And more importantly, the fast, practical, science-backed fixes you can start using right away. Before we dive in, do me a quick favor. Drop a comment and tell me where you're watching from. I love seeing this community around the world. Hit the like button if you value honest men's health guidance. And subscribe so you don't miss future videos designed to help you stay strong, healthy, and confident at every age. Now let's clear up a belief that hurts more men than it helps. A lot of men believe that losing an erection means you're less of a man, you're past your prime, or that it's just an unavoidable part of getting older. That's simply not true. Yes, changes happen with age. Nitric oxide production declines, sensitivity decreases slightly, circulation isn't as robust as it once was. But here's the key point most men miss. Those changes don't mean intimacy is over. They mean your body now needs smarter support. When you understand why erections fade, you can take control again. And the great news? Most of the fixes don't require pills, extreme measures, or embarrassment. They require awareness, strategy, and a few consistent adjustments. For those of you who are new here, welcome. I'm Dr. Jocelyn, and over the past 5 years, I've worked with men dealing with performance anxiety, erection loss during intercourse, hormonal shifts, cardiovascular concerns, and the quiet fear that intimacy might be slipping away. I want to say this directly, doctor to patient. You are not broken, you are not weak, and you are absolutely not alone. I've helped men in their 40s, 50s, 60s, and beyond regain confidence they thought was gone for good. So stay with me, because now we're going to break this down clearly and practically. Number 8, gravity working against you. This one surprises almost everyone. Your position during sex matters. When you're flat on your back and your partner is on top, gravity actually pulls blood out of the penis instead of helping it stay trapped inside. If you have even mild venous leakage, meaning the valves that hold blood in don't seal perfectly, firmness fades faster. Biology. Blood flow follows gravity. Emotion. Losing firmness suddenly can shake confidence. Practical fix. Use gravity to your advantage. Try. Standing positions, kneeling, sitting with your partner facing you. Sometimes a simple change in angle is the difference between frustration and success. Number 7, mental distractions and performance anxiety. Your brain is the most powerful sexual organ you have. The moment thoughts creep in like, what if it happens again? Am I doing this right? Your body flips into fight or flight mode. That shuts down the relaxation response required for erections. Biology. Stress activates the sympathetic nervous system, which blocks erection signals. Emotion. Anxiety feeds shame and self-doubt. Practical fix. Slow your breathing. Focus on sensation, not outcome. Make intimacy playful, not a test. Sometimes even a lighthearted comment breaks the tension and brings firmness back. Number 6, decreased sensitivity with age. Over time, nerve endings in the penis naturally become less sensitive. Conditions like diabetes, high blood pressure, chronic stress can accelerate this process. Less sensation means less feedback to the brain and weaker erections. Biology. Reduced nerve signaling weakens arousal loops. Emotion. Men often misinterpret this as failure. Practical fix. Check testosterone levels. Improve circulation with daily movement. Consider gentle stimulation methods that reawaken nerve response. Think of it as physical therapy, not punishment. Number 5, insufficient arousal. Sometimes the body is present, but the mind isn't. Stress from work, unresolved tension, or distractions can block arousal signals. Biology. Arousal begins in the brain, not the penis. Emotion, feeling rushed kills desire. Practical fix. Take your time with foreplay for yourself, not just your partner. Touch, connection, presence. When the brain is fully engaged, the body follows. Number 4, the self-fulfilling prophecy. Once you lose an erection once, fear of it happening again can make it happen again. This cycle is incredibly common. Biology, fear reinforces stress hormones. Emotion, pressure replaces pleasure. Practical fix. Reframe the moment. Instead of, I must stay hard or I've failed, tell yourself, I'm here to connect and enjoy. Flexibility breaks the anxiety loop and often restores firmness naturally. Number 3, cardiovascular health issues. Here's an important truth. Erections are an early warning system for your heart. Conditions like high cholesterol, hypertension, diabetes, damaged blood vessels, and penile arteries are often affected first. ED can appear 3 to 5 years before a heart problem. Biology. Reduced blood flow equals reduced firmness. Emotion. Fear often leads to avoidance. Practical fix. Daily movement, heart-healthy nutrition, hydration, nitric oxide supporting nutrients. Better circulation improves erections, energy, and longevity. Number 2, hormonal imbalances, low testosterone. Testosterone isn't just about libido. It supports nitric oxide production, penile tissue elasticity, energy, and mood. Levels drop about 1% per year after age 30. Biology. Low testosterone weakens erection quality. Emotion. Men feel flat, disconnected, discouraged. Practical fix. Get tested, don't guess. Lifestyle changes help many men. Others benefit from medical guidance. Restoring healthy levels often reignites desire and sensitivity. Number 1, lifestyle saboteurs, alcohol and timing. This one is often overlooked. Alcohol is a central nervous system depressant. Even a couple of drinks can reduce firmness by up to 25%. And heavy meals divert blood to digestion, not your pelvis. Biology. Blood and nerve signals are diverted away from erections. Emotion. Men blame themselves instead of timing. Practical fix. Keep alcohol light or skip it. Wait at least 90 minutes after a heavy meal before intimacy. The difference is immediate. Here's your simple checklist. Empty your bladder before sex. Choose positions that use gravity. Engage in foreplay for you too. Limit alcohol. Space ejaculation strategically. Many men over 40 benefit from 5 to 7 days. Support vascular health daily. Address sensitivity and hormones head on. These are not gimmicks. These are evidence-based strategies I've seen transform men's lives. If you've been dealing with this, you may have felt shame or even hopelessness. Let me say this clearly. Needing support does not make you weak. It makes you human. I've seen men in their 50s, 60s, even 70s reclaim intimacy they thought was gone forever. And when that happens, it doesn't just change sex. It changes self-respect, relationships, and joy. Your age does not define your vitality. Small, consistent changes can restore confidence, comfort, freedom, dignity. Don't give up, don't stay silent, and don't settle. If this video helped you, like it, comment which fix you'll try first, subscribe so you always have a doctor in your corner. I'm Dr. Jocelyn, and remember, your health, strength, and confidence are worth fighting for. And together, we'll make sure you don't just age, you thrive.